Hey guys, welcome back to Brain Gist. So today I just want to address some misunderstandings about the causes of insomnia or poor sleep. You would often hear people saying things like insomnia is caused by anxiety, insomnia is caused by depression, or there has to be some, you know, psychiatric or mental health problems um, underlying insomnia. That those who have insomnia certainly must have one of these two. And then it's like trying to blame insomnia on some of these issues. And then when patients come to clinic and they deny any of the symptoms suggesting anxiety or depression, some people get confused and they become at a loss of what's going on. I just want to dismiss some of these untruths and explain that while it's true that while I was in my formative years in the medical school, we're actually taught at the time that insomnia was almost exclusively caused by mental health problems like anxiety and depression, and that insomnia was not a disorder in itself, was not a primary and independent problem in itself that needed being addressed, that all we needed to do was diagnose the underlying anxiety and depression, treat them, and then insomnia would disappear. And we thought that was the right thing to do. So we thought treating insomnia itself was like not addressing the main issue. But current knowledge has shown that insomnia indeed is an independent problem. And also clinical experience has taught us, because I have patients in the clinic who don't have anxiety and who don't have depression, yet they have bad insomnia. So while it is true that anxiety and depression can be the cause of insomnia in some individuals, and we do screen for it, and if they're there, we do address them. So we know for sure that people who have insomnia, who have anxiety, can have multiple awakenings in the night and therefore have unrefreshing sleep. And those who have depression tend to have early morning awakening and not being able to continue sleeping for the amount of time they would wish to or would want to sleep for. We do know that that is true, and in such circumstances, anxiety and depression need to be treated, and sleep may improve or may not improve. So there are instances where we identify underlying anxiety and depression and we treat them. Sleep improves a little bit, but yet there is still some insomnia left. So it means that in that situation, insomnia is existing independently. And like I said before, I have a good number of patients in my clinic who do not have any of these issues, anxiety or depression, yet they have insomnia. So insomnia is an independent problem which may or may not be associated with mental health problems. And it's a problem that needs to be, given its recognition and needs to be addressed properly. And I must add that the foremost treatment for insomnia is not sleeping pills. The recommended treatment for insomnia is cognitive and behavioral therapy targeted towards insomnia. And this is a very powerful tool. I've seen patients liberated from insomnia. I've seen patients who are now able to sleep well after going through cognitive and behavioral therapy for insomnia. So I do hope you learned something today. Please share with your friends, colleagues, leave your comments, questions behind. I'll be looking forward to them, and I hope to see you again in future videos. Bye for now.